Shoulder range of motion, internal rotation. Have the patient lie supine on the mat with the shoulder abducted to 90 degrees and the elbow flexed to 90 degrees. While the forearm is in a neutral position, place a towel or cradle under the humerus. The axis of rotation is the olecranon process. The stationary arm is a perpendicular line to the floor, and the mobile arm follows the ulna down and is aligned with the ulnar styloid process. Normal range is 90 degrees. Manual muscle test, upper trapezius. Have the patient sit on the side of the mat with arms at the sides. Place your hands on the top of his shoulders and have him shrug. Resist in a downwards motion. Ankle dorsiflexion range of motion. Have patients sit on the side of the mat with the knees bent and legs dangling. The axis of rotation is the lateral malleolus. The stationary arm is aligned with the fibula using the fibular head for reference. The mobile arm is aligned with the fifth metatarsal. Normal range is 15 degrees. Gluteus maximus manual muscle test. Have your patient lay prone on the mat with the knee of the testing leg bent to 90 degrees. Instruct them to lift the thigh off the mat. Place one hand on the hamstrings and one on the lower back. Resist in a downward direction. Cervical extension range of motion. Have the patient sit with their head in a neutral position. The axis of rotation is the external acoustic meatus. The stationary arm is a perpendicular line to the floor, and the mobile arm is aligned with the bottom of the nose or the nares. Normal range of motion is 60 degrees. Thoracic spine extension manual muscle testing. Have the patient lay prone on the mat table with their hands behind their head. Hold down the ankles of the patient the entire time of the test. Have the patient raise the chest up off the mat table as far as they can. A grade 5 is given to someone who can perform the action without any signs of a struggle, and a 4 is given if there are any signs of fatigue while extending.